Hi, I'm Dr. Dennis Barley. I'm a chiropractor and I'm also a certified chiropractic sports physician. I've been in practice 36 years in Fairhaven, Massachusetts, and I brought Ideal Protein into the practice about 12 years ago, and it's been just a phenomenal addition. First of all, anything that comes into my office, I have to try first. I will not tell my patient to try something or utilize something unless I've done it myself. So when Ideal Protein came into the practice, I did it. And the great thing is most of my staff wanted to do it, so we gave Ideal Protein to the staff. And when I did it, I lost 8 pounds in my first week. I lost 2 inches on my waist, and I dropped 70 points of total cholesterol. That had never happened before. Ideal Protein is so effective because it doesn't stop at weight loss. It actually moves into stabilizing your weight and maintaining your weight long term. The holy grail of this weight loss industry is actually holding on to the weight loss. There are so many failures of someone starting a diet, losing the weight, and regaining, and then some. If you follow our 3 phases of the protocol, you will maintain your weight long term. I love the science behind Ideal Protein, and the science behind this protocol to me is just what convinced me to do the protocol, bring it into the practice. We put them on our protocol with adequate protein, healthy fats, not abundant, but healthy fats, and restricted carbohydrates, plenty of water, whole foods, and partial meal replacements, Ideal Protein partial meal replacements, plus supplementation that brings their macronutrients and their micronutrients while they're losing weight into balance. As we do that, we've changed them from an insulin-dominant patient to a glucagon-dominant patient, meaning that they're starting to use their own fat as energy. Once we move from there into our stabilization phase, we develop their macro code. They come in understanding how many servings of protein and fat they need, and then we retitrate in at 5 grams weekly from a baseline of complex foundational carbohydrates that are actually very healthy and good for the patient. And what we're doing there is we're balancing that insulin to glucagon ratio. As we balance that out and that patient is maintained there, we can move them into maintenance and they actually hold on to their weight loss. Physicians should refer their patients to Ideal Protein because they know that a majority of their patients are sick. This obesity epidemic is just devastating the health of their patients. As a non-prescribing doctor of chiropractic may have a phenomenal impact on your patient if you use Ideal Protein as a tool to get your patient healthy. My patients have benefited from Ideal Protein in so many ways. I've been in practice 36 years. And I had a patient probably with me for 30 of those 36, and she said, "This is probably the best thing you've ever done, especially for me." We also see a return to a quality of life that they lost. You know, there's been a lot of great things. People doing triathlons and running now and hiking and enjoying life, having way more energy. I mean, that's just one of the biggest side effects. So the weight loss is great, that's the side effect, but you're regaining your health, and that's what's really important. I would say to a provider, read the science, because that's what turned me on. That's what got me to come on to Ideal Protein. The science is solid. There were some things that Ideal Protein taught me that even having the nutrition and science background I had before, I didn't know. So I was really fortunate to come across Ideal Protein, not only for my patients and my practice, but for myself also. And then from the business side, I'll talk about the business side, is the financial end of this ancillary revenue that you get in from Ideal Protein, and it's cash-based, is pretty substantial. So you're doing a good thing for your patients, you're doing a good thing for your practice.